We could begin as a subcommittee if we had an author. We're looking for Assemblymember Jones. I'd like to make an announcement about the agenda. Item 1, which is AB, and I've crossed it out already, 3 or 294, 394, has been removed from the agenda. So we're waiting for Assemblymember Jones, and we have 2 bills that are coming off suspense for a vote only. In any case, we need a quorum for that. So we are awaiting Assemblymember Jones, or a quorum, and/or a quorum. We will now begin as a subcommittee. Welcome, Assemblymember Jones. Come forward.
Madam Chair.
For the speaker, you are presenting AB 1422.
Sneak out and see if Roy's right there.
Yeah. Welcome.
Thank you very much, Madam Chair, members of the Senate Revenue and Taxation Committee. It's my pleasure to present AB 1422 on behalf of the Speaker, Karen Bass. This bill institutes a funding mechanism to avoid disenrolling 670,000 low-income children in the state's Healthy Families Program, and will remove the current waiting list for that program through 2010. As you know, the Healthy Families Program is California's premier program to provide health insurance under the federal Children's Health Insurance Program. It provides health, dental, and vision coverage to children and families with incomes generally between 100% and 250% of the federal poverty level. Due to the state's fiscal crisis, cuts have been made to that program, which will result in the disenrollment of 670,000 children. The Speaker, the Pro Tem, the Governor, Mr. Mibb, the health plans themselves, and health insurers have all come together in a very collaborative process to craft this bill to provide a funding stream to avoid that disenrollment.
Excuse me, Assembly Member, we do have a quorum, and I would like to establish that. Please call the roll.
Wolk. Here. Wolk present. Walters.
Here.
Walters present. Alquist. Ashburn.
Present.
Ashburn present. Flores.
Sometimes.
Flores present. Padilla. Runner. Wiggins.
Aye.
Wiggins present.
Assembly Member.
Thank you very much. And I want to thank the Chair as well and her staff for working so closely with the Speaker and the Pro Tem. And I want to thank the health plans for their collaborative approach to addressing this extraordinary crisis. What the bill does in particular is it extends the 2.35% gross premium tax that currently exists on insurers to Medi-Cal managed care plans until January 1st, 2011. That will generate approximately $157 million, which will itself generate approximately $97 million in federal matching funds. This is very critically important to note. What this allows us to do is to take advantage of the enhanced FMAP, which is the enhanced federal Medicaid funding that's available under the Federal Economic Stimulus Recovery Act in a way that we would not otherwise be able to do. All of the plans that would be paying this extended tax are in support of the measure. In addition, the state's First Five Commission, in a unanimous vote, pledged up to $81.4 million to cover the state share of premiums for children between 0 to 5. The bill additionally provides the State Commission the ability to transfer unspent funds in the mass media, education, child care, and research and development account into the unallocated account upon approval by the State Commission. It also gives the Department of Finance the authority to adjust spending levels to incorporate the receipt of the first $5. So the bottom line here is First Five is also stepping up. The bill facilitates that and allows them to participate as well in solving this problem. Now, the third important thing the bill does is it provides for increased share of cost for enrollees in the program. So everyone is participating in trying to resolve the problem. Beginning November 1st, 2009, families with incomes between 150 and 200% of the federal poverty level will see premium increases of $4 per child per month. For families with incomes between 200 and 250% of federal poverty level, their premiums are increased $7 per child per month. For the lowest income families, those below 150% of federal poverty level, the Speaker and Pro Tem determined that there would be no premium increases because those are the families that are least able to pay anything. But everyone else is going to participate in solving the problem. The bill also makes conforming premium increases to the discounted community provider plans. Mr. Mibb intends to increase copays for emergency room visits, brand name drugs, non-preventive care visits. All this, again, a part of the package put together to try to address the shortfall within healthy families. So I'm very pleased to report that we have unanimous support for the bill and truly a collaborative effort in very short order to bring this bill to this committee. And again, I want to thank the Chair and her staff for all of their tremendous leadership in allowing us to get to this point as well. We have some witnesses who would like to speak on behalf of the bill.
And Assembly Member, let me just clarify. We have some amendments on page 7 that you will be taking in, or the Speaker will be taking in appropriations due to their timing.
We are very happy to take them, and I apologize for not noting those. Perhaps the most significant of which, although they're all obviously important, is the one that clarifies that the treatment with regard to the dental plans, specialty dental plans, that they're not subject to the gross premiums tax. And as the Chair has pointed out, these are called out on page 7 of the analysis, and we're very pleased to take those. And my understanding is they are in print. They are in print before the committee at this time.
Okay, and they will be taken in approps. All right, in support. Welcome.
Toby Douglas, Chief Deputy Director, Department of Healthcare Services. The Department of Healthcare Services strongly supports AB 1422. This bill is a vehicle for continuing the quality assurance fee that the Medi-Cal managed care plans have been paying for the last several years by extending a general purpose tax to the Medi-Cal managed care plans, which is the gross premium tax. This will lead to a net general fund revenue of $97 million that can then be used for the Healthy Families Program. So as Assemblymember Jones said, this is a way of preserving the Healthy Families Program. And finally, this bill encompasses shared responsibility. It includes components that increase the copays for Healthy Families members, the premium amounts. As well, it includes a way to create more flexibility in the First Five Commission and its ability to move funds. So again, we strongly support this bill. Thank you very much.
In support?
Thank you, Madam Chair, members. Dan Chick with HealthNet. As one of those who will be paying the tax, we just wanted to assure you that we view this only as an extension of the existing QIF for a couple more years. It doesn't present any unique administrative burdens for us, and in fact, we're rather happy to be part of the solution for the Healthy Families to avoid massive disenrollment. For us, in particular, we'll probably be paying about half of what we had paid before on the prior QIF. And I also want to point out that none of our commercial payers will be paying any additional amount in premiums as a result of that. And with that, we just urge your aye vote. Thank you.
In support? Further support?
Thank you, Madam Chair and members. Nick Luizos with the California Association of Health Plans. Our association represents 39 health plans, many of which partner with the state to deliver important public health coverage programs. We are in support of the bill. We are the industry that is subject to the tax provision of this bill. We support the underlying purpose, and it's moving forward with the consensus of our industry. We just wanted to emphasize, in addition, that the consumers in our commercial market will not see or feel the impact of this tax as it applies to our Medi-Cal managed care lines of business. And the bill is being pursued in the context of a larger effort, including other contributions from other funding sources and the program-related changes that have been described by Assemblymember Jones and others. So we want to emphasize that our trade association is in support of this, and we hope that it passes committee today. Thank you.
Okay, thank you. Briefly, in support.
Catherine Reese representing CenCal Health, which is the oldest county-organized health plan serving both Santa Barbara and San Luis Obispo counties. We do Medi-Cal and Healthy Families. We would urge your support for this measure.
Thank you. In support?
Jim Gross on behalf of the Local Health Plans of California, which are 9 health plans throughout the state that are created by statute. This is very much a part of our mission to have these revenues ensure that these children remain covered in the Healthy Families Program. This is something we've been working on with the administration we want to thank, and with the legislature. We've been working on this for about 3 months now, and we're really happy to have it come to fruition. And we also thank your staff for the work on this over that time. Thank you.
In support.
Trent Smith on behalf of 4 county organized health systems, including Partnership, Cal Optima, Central Coast, and Health Plan of San Mateo, and very strong support to maintain Healthy Families programs in our service areas.
Thank you. In support.
Tahira Bazil, California Primary Care Association, representing over 800 community clinics in the state of California. We are also in strong support of AB 1422. However, we would like to strongly recommend that the premium increase has a sunset date of January 1, 2011, the same time as the assessment expires. Premium increases will render Healthy Families unaffordable to many families and may disenroll children. And while we support the shared responsibility piece of it, we do believe that the sunset date would allow you guys the opportunity to secure sustainable funding for the program and let children continue to receive the care they need. So we ask for your...
This proceeds to the Health Committee, and
yes.
I assume you've been having discussions with them?
Yes.
Okay.
Thank you.
On that issue.
Thank you, Madam Chair, members of the committee. Maureen O'Haron, representing Access Dental, and we appreciate the Speaker and her staff working with us on the amendments that clarify that. And also, I'm here in support of Molina Health, in representing Molina Healthcare of California, also in support. This bill is vital to keep these children insured, especially as we go into flu season, which is going to be doubly compounded this year by swine flu. We ask your support. Thank you.
In support.
Jason Gappert with the Association of California Life and Health Insurance Companies in support.
Support.
Nicole Wertelman on behalf of the City and County of San Francisco, as well as the Alameda County Board of Supervisors in support.
Support.
Chad Silva with Latino Coalition for Healthy California in strong support.
Terry Calgar-Hill on behalf of the 100% campaign in Pico, California, in strong support.
Okay. Further support? Opposition? Seeing none, questions from the committee? Yes, Mr. Renner.
Just to clarify, the issue of the tax itself, who actually pays the tax?
My understanding is the tax is paid by the managed care plans.
Maybe somebody from the industry could
Absolutely.
come on up and help
up.
us
But
walk through
there's
this.
one point that bears underscoring, and several of the witnesses testified to this, but I failed to do so in my opening remarks, and that is there's an existing provider fee which will end in October. This essentially substitutes for that. And does more than substitute for that. It ensures that as a result of using this tax and dedicating this tax, a portion of this tax, significant portion of this tax, to pulling down enhanced Medicaid dollars and putting those monies back into the managed care plans, that there is no impact in terms of a pass-through of costs to the beneficiaries and consumers of those plans. And a number of the plans alluded to that. So I think it really bears underscoring that not only are we essentially terminating a provider fee that doesn't act in that way, but we are substituting for it a time-limited approach that will result in no net pass-through to consumers. Mr. Gross.
Let me again kind of clarify what it is that I'm looking for here. First of all, I want to know who pays this tax. How is it passed? Who actually is going to actually see either a premium go up or a cost go down, or how does that work? The second thing is, Assembly member just brought up the issue of a premium fee that expires. So my follow-up question to that is this to replace that premium fee, and so is this actually then a revenue neutral aspect in regards to costs? So take a stab at those.
First, on the expiring QIF, which was passed in 2003 in a budget trailer bill, which was technically a fee, that expires in September. I believe the amount was 5.5% of gross revenues of Medi-Cal business only. Toby, is that correct?
Is that the same universe of people who are targeted for this particular tax issue?
It is the same universe. There's a few county organized health systems that weren't taxed under the previous one that will be included on this, but for the most part, the same universe.
And that was at 5%?
5.5%. The budget that was enacted took into account the ending, the expiration of that tax. So the revenue that comes from this new one is new revenue that hasn't been accounted for.
Okay, because that one was set to expire.
It was set to expire. It was already included in the budget.
Okay.
But it is the same group. It's just lowering it from 5.5% to 2.35%. The same plans that the way they were paying it before. They'll pay it again. They'll now pay it to the Department of Insurance, but it's the same process.
Let's go back to the other issue, and that is the issue in regards to who pays this. How? I mean, obviously, it's a tax that's somebody's going to be paying. Who is it that actually ends up paying that tax?
Well, we would pay that as part of our Medi-Cal managed care business in the extent of 2.35% of the gross premium, similar to what property and casualty insurers currently pay.
Now, when you say we pay it, I mean, obviously industries get all kinds of fees, and their profit, nonprofit, whatever their status is. Typically, they don't take that out of their bottom line. They pass that along.
Correct.
So who does it get passed along to?
Well, we would pass it up to the general fund or to the department.
Let me just say the way we set our rates, we have a rate and setting process that takes into account all different costs. When we took into account the quality assurance fee, that was a cost. This would be a cost that's built into it the same way. So we are accounting for it, but in the bottom line numbers that we've talked about in terms of $97 million, that takes into account how it is incorporated in our rate-setting methodology. So at the end result, it's $97 million to the general fund after taking into account the need to incorporate these costs into the rate-setting methodology.
So the general fund is then responsible for paying that tax?
Maybe we could take a step back. I think that...
Can I try?
Yes.
Can I try? I understand why the confusion. I apologize because I didn't emphasize enough what's happening between these two components. 34% 95% of this is going to go back to the Medi-Cal managed care plans. And the way it goes back to them is that we take a portion of this tax and we use it as a match to pull down additional federal Medicaid dollars, which allows us to reimburse the plans for the work they do at a higher rate. So as the plans testify to, there is no net increased cost to their bottom line and no necessity to pass through any price increase to their consumers.
So in essence, maybe if I'm trying to see if I get my arms around this, in essence, it's because the fact that this is going to be able to pull down additional federal dollars that enables the cost to be covered by those new dollars, as opposed to having to be passed on in terms of any kind of a cost to a premium. Correct. Somebody else pays. Now, let me ask one other follow-up question, and that is, explain to me the firewall that I think the plans have that exists between those who are involved in these healthy family programs and the premiums paid there versus those who are part of other plans that are just purchased by, whether it's HealthNet or whatever, and the effect that happens. Is there an effect between the cost between what happens on this side of that firewall in regards to the cost to healthy families in this particular issue, and those who just have a regular insurance policy?
I think the answer is yes, there is a firewall. The premium increase...
No, there is. That's why I want you to walk through that with everybody.
And I'll let the gentleman do that. But the premium increase that I alluded to in my opening remarks is limited solely to those who are recipients under the state's Healthy Families program. That premium increase does not apply to those that are separately enrolled within the managed care plans who will be paying the gross premiums tax. And there's a strong firewall because it's based on eligibility. And only if you're in the Healthy Families program will you be paying that modest premium increase. And they're deriving a significant benefit, obviously, because that program is subsidized significantly by the federal government. And part of the reason we're here today is to try to pull down those federal dollars to do exactly that.
Okay. Mr. Runner, Jim Gross on behalf of the Local Health Plans of California. The firewall I think you're referring to relates to the fact that most of these entities already have separate legal corporations that contract with the Department of Health Care Services. The way the bill is written is it is those entities that will be subject to the tax. So that, for instance, a HealthNet, which has multiple legal entities, some of which are doing typical commercial business, are not part of the equation in this bill and are not subject to that tax. Only the separate legal entity that actually was created when we did the quality improvement fee for that very purpose is the only entity subject to it. So I would characterize that as a firewall, if that's what you were referring to.
And so, in essence, it seems to me what we're trying to get to here is the fact that the exposure to any additional cost, if there was an exposure to additional cost, is limited to those who are receiving the public benefit.
Yes, Senator.
That's correct. We have a separate entity that was created after the QIF, and it's
so
like a
if
silo
there's an
that has
additional
it inside.
cost, it's those who are already receiving a public benefit who are going to have to then absorb that. However, the belief is that the additional federal dollars that this creates will compensate for that cost.
That's correct.
Okay, thank you.
And Senator, it's also important to note that the way it's structured now, there would be no additional threat to the general fund as far as the scoring of the savings of the $174 million cut. We're, in essence, taking this off ledger for
Let me just follow. And what happens when all of a sudden, if these federal dollars, what future pressure does this put on?
There's poison pills. I'm sorry,
None. I mean, the bill.
How do we protect that?
Well, the bill states explicitly this ends January 1st, 2011.
Okay.
So, comes to a halt.
Okay.
Right.
Okay, further questions from the committee? Is there a motion? No. Would you like to do that? Senator Wiggins has moved the bill. Would you like? Pardon? I already did that. Would you like to close?
I just want to again thank the chair and her very able staff, the governor, the governor's very, very able staff, the department, and the speaker, the pro tem, and everyone who's come together, the plans themselves, in crafting what I think is an extraordinary win-win for California's children, for the plans, for California consumers and taxpayers. I'd ask for aye vote.
All right, the motion is due pass to the Health Committee. Please call the roll.
Wolk.
Aye.
Wolk, aye. Walters.
No.
Walters, no. Alquist.
Aye.
Alquist, aye. Ashburn.
Aye.
Ashburn, aye. Flores.
Aye.
Flores, aye. Padilla.
Aye.
Padilla, aye. Runner. Wiggins.
Aye.
Wiggins, aye. That's 6-1.
6-1. The bill is out.
Thank you, Madam Chair. Thank you, Senators.
We have two more items on our agenda. We do not need authors, but we happen to have one here. Item number 3, this is for vote only since these were on suspense. This is Senator Padilla, the cigarette and tobacco products taxes. I need a motion.
I move the bill.
The bill has been moved. Please call the roll.
Wolk.
Aye.
Wolk, aye. Walters.
No.
Walters, no. Alquist.
Aye.
Alquist, aye. Ashburn.
No.
Ashburn, no. Flores. Padilla.
Aye.
Padilla, aye. Runner.
No.
Runner, no. Wiggins.
Aye.
Wiggins, aye. That's 4-3.
4-3. We will leave that bill on. We will leave that on call. Flores, aye.
Flores, aye. That's 5.
5-1. The bill is out. Item 4 is Ms. Caballero's bill. It's an income tax credit involving principal residence. Is there a motion?
I move the bill.
Been moved by Senator Alquist. Please call the roll.
Wolk.
Aye.
Wolk, aye. Walters.
Aye.
Walters, aye. Alquist.
Aye.
Alquist, aye. Ashburn. Ashburn, aye. Flores. Flores, aye. Padilla. Padilla, aye. Runner. Runner, aye. Wiggins.
Aye.
Wiggins, aye. 8-0.
The vote is 8-0, and that bill is out. I believe that is our agenda for the morning. Thank you very much. We are adjourned.